Health experts finding that some children are experiencing debilitating effects of having COVID that have lingered for months after the initial COVID infection.
And doctors in Alabama tell us that they're still struggling to understand what causes long COVID in adults and how to treat it. But experts say the conditions in children is even less understood. News 19's Archie Snowden is in studio and joins us now with more on this.
Okay, thank you, Madison. There are some common symptoms doctors say in Alabama that are seeing in teenagers that is now an ongoing health problem. One mother tells us that her son has been struggling with issues that seem to have no end. Carla Mangrini's 15-year-old son got COVID back in January. He spent several days in UAB hospital. After a harrowing battle with the virus, her son came back home. His mom figured he had beaten COVID.
Like, my son is home, he's fine, he's healthy, he's never had any health issues. But then we started picking up, I think, on little things.
Mangrini said her son's health went downhill. Her strong, athletic son hit a wall.
I think it was the brain fog, the forgetfulness, confusion.
Kids seem like they're having ongoing symptoms, and it's having real ramifications.
Dr. Camden Hebston of UAB has treated kids who seemed fine and then suddenly find themselves fighting delayed after effects of their COVID infection. Debilitating effects, headaches, brain fog, and fatigue. These kids have been termed as long haulers.
They're previously, healthy kid who you couldn't hold them down. They were going to go do 4 things after school. And now they're really just sort of sitting there and feeling bad and feeling poorly.
Doctors admittingly are struggling to find answers as to why the condition persists and exactly how to treat it.
We don't exactly know why. We don't exactly know how long, whether or not vaccination prevents that. Makes it less likely. There's just so many things we don't know about.
In some cases, doctors say that it's possible that COVID-19 has sparked conditions in children that may have not emerged until now, or orthostatic intolerance.
Orthostatic intolerance is a very common set of symptoms in kids in general, and some kids have that predisposition to begin with, and COVID ends up being the push that produced all those symptoms for them.
Dr. Hebson says that the condition is in children ages 12 to 17. He added that the symptoms are manageable, but urges parents to see a doctor to get an update on their health history. Madison?